Assalamualukm respected doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the video number is 350 on our YouTube channel, mean 349 same videos are present on our YouTube channel. Now today our lecture is related to pharmacology and today topic is routes of drug administration. Now today topic outlined we will cover is number 1, definition of routes of drug administration, and number 2 is the classification of routes of drug administration, and third number we will discuss about bioavailability. Next is the first pass effect or first pass metabolism, and last is the each route's detail, mean definition, advantages, disadvantages of each route. First we start from definition of routes of drug administration. Routes of administration is the path by which a drug is given to the body, mean it is a path. Now look at this diagram. Here all the paths are shown, like sublingual below the tongue, inhalational, oral, transdermal, topical, and parenteral mean IV, intravascular, and IM mean intramuscular. IV mean intravenous. Now come to the classification. In classification, routes of drug administration we classify into two, local and systematic. Local mean at a localized site. Then we divide into 3, topical, intraarticular, and intrathecal. Topical into skin and mucosa, intraarticular into joint, or intrathecal or intraspinal into the spinal cord. Now come to the systematic. In systematic, again we divide into enteral through GIT, then in enteral into oral or rectal, and next is the parenteral other than GIT, in parenteral intravenous, intramuscular, subcutaneous, sublingual, inhalational. Now after classification come to the concept bioavailability. What is bioavailability? It is a fraction of unchanged drug reaching systematic circulation after administration by any route. This is bioavailability, mean which amount of unchanged drug reach to the circulation. Now the bioavailability of IV route is 100%. Now oral administration route have low bioavailability. Now why? We start from question, why oral route have low bioavailability? The first thing is due to incomplete absorption through GIT. Number 2, absorbed drugs undergo first pass metabolism. Okay? Now come to the fourth topic. What is first pass effect? Yeah, first pass metabolism. First pass metabolism is the metabolism of drug during its passage into the gut, liver or lungs before reaching the systematic circulation. When we inject the drug, before reaching to the blood systematic circulation, the drug becomes metabolized into gut, liver or lungs. This is known as first pass metabolism. Look at this diagram. If we inject by oral route, they come to the liver, then come to the rest of body. But if we inject by IV route intravenous, they directly come to the body. Now look at another diagram. Here again show the first pass effect. Look at on the left side, through oral route, through GIT, first drug come to the liver, then from liver it metabolize and then go to the general circulation. Now look at another diagram, first pass effect. This is the GI tract through oral route. First drug go to the liver, then go to the general circulation. Mean before reaching to the general circulation, the drug become metabolized and the less unchanged drug reach to the circulation. Look at another diagram. We inject the dose. First it metabolizes into the gut, then through portal vein it go to the liver and again metabolize, and the less amount of drug reach to the circulation is known as bioavailability, which is unchanged drug. Now the question is that how to avoid first pass metabolism? How to avoid first pass metabolism? Mean we do not want drug go to the liver. Then we have methods. Number one is sublingually. We place the drug below the tongue. Next is transdermally through skin. Third, by injection, mean intravenous or intramuscular. Fourth, rectally to some extent. Avoid first pass metabolism. Now come to the detail of routes of administration. First is the local routes. These local routes, these can only be used for localized action at accessible site for drug. Though systematic from this in order to minimal involvement of the other body system. For example, in the local route, ointment. Now here through local route the concentration of drug is attained at the required site without exposing to the whole body. Now in a local route, first is a topical route. Now in topical route, drugs are applied topically to the skin or mucous membrane mainly for localized action. Now in topical route, we already studied in classification skin and mucosa has come. Now in topical route, first skin. For skin we use, for example, cream, ointment. Look at this diagram. This show the application of ointment on the skin. This is the topical route. Now after skin, come to the mucosa, mean mucosal membrane. On mucosal membrane mainly we use drops. For example, eye drops in conjunctiva of eyes. Second is the ear drops. The third is the nose nasal drops. Now look at this diagram. The patient use eye drops in the conjunctiva of eye. This is the topical route. Now come to the local route. Now come to the next, intra-articular injection. Mean intra mean inside, articular mean joint. Sometimes a glucocorticoid is injected in the inflamed joint space to relieve pain. Look at this diagram. This is the knee joint, synovial joint. We inject the glucocorticoid, mean inside the joint, intra-articular injection to relieve the pain. Now the third local route is the intrathecal, mean intraspinal. Here in intrathecal or intraspinal, drug is injected into the subarachnoid space, mean a space below the arachnoid matter and pia mater, by a lumbar puncture. This method is used for diagnostic purposes, like for example in myelogropy, for diagnostic purpose. And this method is also used for therapeutic purposes, like to produce spinal anesthesia or for the treatment of meningitis. Now look at this diagram. Here the subarachnoid space between pia mater and arachnoid mater. Below the arachnoid mater and above the pia mater, there is a subarachnoid space. Now next is the epidural or extradural or peridural route injection. This is also the localized method. Now here The epidural means above the durameter. Here are extradural or peridural. Drug is deposited between the durameter and periosteal lining of the spinal canal. This method is used to produce epidural nerve block by local anesthetics. Now, this route is used in obstetric also. Look at this diagram. Here the epidural injection is given above the epidural mean above the durameter, mean between durameter and spinal canal area. Now come to the fifth local injection. This is the intracardiac injection. Now in sudden cardiac arrest injection, we inject the adrenaline directly into the heart. This is known as intracardiac injection. Method, we inject a long needle into the left fourth intercostal space close to the sternum. Now come to the final, the sixth local injection method is the intraperitoneal injection. In intraperitoneal injection, this route is mostly used for peritoneal dialysis method. Now after local injection method, come to the systematic routes. In systematic routes, first is the enteral routes. How we define the enteral routes? In enteral route, when a drug is placed directly into the GI tract is called enteral route. Now in enteral route, first is the oral route. Now oral route is a generally safest, most convenient and the economical route. This route is not suitable for in vomiting, convulsion and coma patient. Now come to the picture of oral route. Now in systematic route we will know about advantages and disadvantages. So here the patient take tablet by oral route. Next diagram, here is a child which take syrup by oral route. This is a child which take syrup by oral route. Now come to the advantages of oral route. We will study each route advantages and disadvantages also. Now come to the advantages of oral route. We will remember by mnemonic CAC mean cake. Here are the three advantages of oral route. First advantage is a convenient. Oral route is convenient. What convenient mean? Convenient mean by oral route drug can be self-administered, mean patient itself. Second is the pain-free. Oral route is pain-free. Third is the easy to take. This is the convenient mean. Now come to the cake. In cake C, after C this is the A. A mean absorption. Now absorption take place along the whole length of GI tract. This is the second advantage. The third advantage is CAC. Next C is the cheap. Mean oral route is a cheap route as compared to the mostly of the parenteral routes. Now after advantages, come to the disadvantages of oral route. The first disadvantage of oral route is sometimes ineffective. Mean only part of drug is may be absorbed, not whole drugs. Second disadvantage is the first pass effect. Mean drug absorbed orally initially transported to the liver via the portal vein, then reach to the general circulation. The third Disadvantage is the irritation to gastric mucosa, and the result there will be nausea and vomiting. And next is the destruction of drug by gastric acid and digestive juices. Next disadvantage is effect too slow per emergency. We cannot inject in emergency. Next is the unpleasant taste of some drugs because we take it orally. And seventh disadvantage is the unable to use in unconscious patient because it cannot take orally. Now come to the sublingual route, or also known as buccal route. Now, sometimes drugs, for example, nitroglycerin is given under the tongue, are rapidly absorbed in the general circulation by it bypass the first metabolism, and a small dose is sufficient. Now, here the advantages of sublingual or buccal route. First advantage of sublingual or buccal route is the rapid absorption through capillary bed below the tongue. Second is the drug stability because drug is stable, not go to first pass effect. Third advantage is it's avoid first pass effect, mean first pass metabolism. Now come to the disadvantages of sublingual or buccal route. Disadvantages of sublingual or buccal route is number one, inconvenient. It is not convenient for patient because when patient places the drug below the tongue. Second is the small dose. We give only small dose through sublingual route. We cannot give a large dose. The third, unpleasant taste because we place directly below the tongue. Now after sublingual route, come to the rectal route. Now the rectal route, it is suitable in cases of convulsion and vomiting and drug causing gastric distress. Now advantages of rectal routes. What are the advantages of rectal route? Number one, we give drug by rectal route in unconscious patient and children. Number two, if a patient is nauseous or vomiting, we again give by rectal route drug. Third is the good for drugs affecting the bowel. For example, laxative in constipation. These are the advantages of rectal route. Now come to the disadvantages of rectal route. What are the disadvantages of rectal route? Number one is the disadvantages of rectal route is the inconvenient because it is not convenient for patient. Also it is unethical. Second is the absorption. Absorption is slow through rectal route. The third is the irritation or inflammation of the rectal mucosa. Now come to the diagram of sublingual and rectal route. This is a sublingual route. A patient placed the drug below the tongue. This is a sublingual route diagram. Now come to the rectal route diagram. Here this is the rectal route in enema or suppositories. A drug is placed by finger into the rectum. This is the rectal route. Now in systematic, after enteral route, come to the parental route. Now the term parenteral is come from the Greek word para mean outside and entron mean intestine, mean the root outer than parenteral route. Now how we define the parenteral route? We define the parenteral route, drugs given by any route other than GIT is known as parenteral route. Now the question arises when we need parenteral route. When we need parenteral route, number one, if drug is poorly absorbed from the gut, then we prepare parenteral route. Second, if drug inactivated by gastric and intestinal enzymes, again we prepare parenteral route. Third, if drug extensively metabolized by first pass effect, again we will prepare the parenteral route. Fourth, if the patient is unable to take oral medication, again we prepare the parenteral route. Next is if a rapid effect is required, like in emergency, again we prepare the parenteral route. In parenteral route, first is the intravenous injections. In intravenous injection, drugs injected directly into the veins. Now look at this diagram. Up intravenous route, in parenteral route, we directly inject the drugs into the veins. Look at the blue vein. Now look at the next diagram of IV route. The drug is injected directly into the veins. Now come to the advantages of IV route. Now the advantages of IV route is, first advantage is bioavailability of the intravenous route is 100%. Second, desired blood concentration we can achieve because we can give large dose. The third is the large quantities we can achieve. Next is we can give drug by IV route in vomiting and diarrhea patient. Next is we can give IV route drug in emergency situation. The sixth advantage is the first pass effect is avoided, therefore bioavailability is 100%. Number 7 disadvantage is the gastric manipulation is avoided. These are the 7 advantages of IV route. Now come to the disadvantages of IV routes. Number 1 is the irritation and cellulitis. Cellulitis is a superficial skin infection which caused by bacteria. Here IV route can cause cellulitis irritation. Number 2, thrombophlebitis. What is thrombophlebitis? It is a blockage of vein due to clot. The third, it is less convenient. It is not easy route. Number 4 is the painful because patient feel pain. Number 5 is the techniques required. Everyone cannot give IV injection. It's required technical skill. Now come to the after IV, come to the intramuscular injection. Now absorption from this route is more rapid from subcutaneous injections site. This is suitable for mild irritation solution or suspension we also given from this route. Now come to the advantages of IM, mean intramuscular route. The first advantage is drug is uniform absorption. There is a uniform absorption, mean uniform absorption of drug through IM route. Second is the rapid onset of action. The third is the mild irritants can be given through IM route. Fourth advantage is the first pass if effect are avoided. And number 5th is the gastric factors can be avoided. These are the advantages of IM route. Now look at this diagram per IM route. Here in diagram we give intramuscular injection. We place the injection 90 degree perpendicular to the skin. Look at another diagram. We inject the IM injection below the cutaneous tissue into the muscle, below the subcutaneous tissue into the muscular layer. This is the IM injection. Now come to the disadvantages of IM route. Number one, only up to 10 ml drug given by this route, not more than 10 ml. Number two, local pain and abscess. Mainly abscess occur through this route. The third is it is expensive route. And the fourth disadvantage of IM route is the infection. And the fifth is the most dangerous is the nerve damage. Now after IM, come to the subcutaneous route. In subcutaneous route, drug injected under the skin, and absorption is slow through subcutaneous route, but action is prolonged. Absorption is slow, so action is prolonged. Look at this diagram. Patient inject the drug subcutaneously. Now come to the diagram of subcutaneous route. Here the drug is injected in the subcutaneous layer above the muscle layer. Now after subcutaneous, come to the intradermal injection. In intradermal injection, drug is given within the skin layer, mean intradermal, into the dermis. Now, mainly this route is mainly used for testing sensitivity to the drugs. For example, if a patient is sensitive to the penicillin, we give the intradermal injection. Look at this diagram. We inject the penicillin into the intradermal layer. Look at the patient sensitivity to the drugs. Now last is the inhalation route. In inhalation route, it is used for gaseous agents, volatile agents, and aerosols, mean aerosol sprays. Now look at this diagram. Patient use inhalation route. Patient inhale the substance through the nose. Now look at another diagram. Here the patient use a nebulizer and the device by which he take the drugs in the stomach. Now come to the advantages of inhalation route. What are the advantages of inhalation route? Number one, large surface area in inhalation route. Second is it serves as a local route in lungs diseases like asthma. The third is the high blood flow in the inhalation route. And the fourth is the first pass effect is avoided. And the fifth is the small dose, since directly delivery mean less toxicity, means small dose is sufficient because due to rapid absorption. Now note why rapid onset of action is in inhalation route. Rapid onset of action is due to the rapid access of drug to the circulation due to large surface area, more blood flow. Now come to the disadvantages of inhalation routes. What are the disadvantages of inhalation route? Number one is it required special apparatus. Special apparatus is required. Second, irritation of the respiratory tract. The third, cooperation of patient is required because patient use this inhalation device in the home. Now come to the last chart, which is the bioavailability comparison of different route. In IV route 100% bioavailability, then in intradermal 80%, then in subcutaneous and intramuscular 75%, and same look at same diagram. The characteristics in intravenous more rapid onset, in intramuscular large volume, or subcutaneous small volume than IM, and oral most convenient, first pass effect may be significant in and these are the comparison of different routes, bioavailability and characteristics. Now today our topic is end. Now we bring Telegram channels and WhatsApp groups for you people. If you are MBBS student, we have a channel in Telegrams by the name First to Final Year MBBS Lecture, where you can find books, notes, videos, and links and past papers. If you are a BDS student, we have a Telegram channel for you by the name First to Final Year BDS Lectures. And we have a WhatsApp group for first year boys separately, and we have a first year BDS WhatsApp group for first year girls separately. There we can share daily books, notes, videos, and we have second BDS group for boys, and we have a third BDS group for boys, in future we will create for girls also. Now all links of Telegram channels and WhatsApp group are present in the description of this video. You can directly join by clicking the links. Now if you like my video, press the like button and share this video with your friends. If you new to my channel, subscribe channel by pressing the red subscribe button, and also press the bell icon in order to you receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.